Dr. Shanti, she's also with us in the advisory committee. She's the intensive care doctor. She will be moderating the question answer session, and also Dr. Shankari, oncologist, she will be also moderating this question answer session. With this, I'll quickly go to the speakers to start their presentation. First, Dr. Arulamudan.
Yes, I will start. Thank you, madam, for the brief introduction about the today's seminar and speakers. So, good morning to the audience from US and good evening to the Asian participants. Today's the session is actually focused on prevention of respiratory illness, special emphasis on seasonal allergies and flu. So, because now the season is actually changing and people have lots of doubt about the allergic and seasonal influence on respiratory. So today's talk is about that. The first part will be covered by me, and the subsequently second part will be done by Dr. Selva. So we know that all the living beings living in this earth, we have to undergo the seasonal or the environmental influence. Nobody can escape. So trees, they cannot move from the place where it is living. So it will undergo a lot of changes that will be visible. Same way, the each time you can see that during rainy season the growth. This is the cross sectional of a tree timber. So the growth will be more, and during the dry season the growth, the growth width is actually less. So it is a part of the life, up and down. It is, that's what it is saying. So similarly, human also exposed with the nature. So we also have to undergo the seasonal influence. So Siddha medicine, actually they have categorized the seasonal influence in different perspective. So in US you may be having the 4 major seasons, but as per the Siddha literature, every 2 months there will be a seasonal change. So that part I will be explaining so that you will understand better. So the rainy season, it is a one season that will actually persist for 2 months. After rainy season, 2 months will be the breeze season. After that, the early winter season, 2 months. Then late winter season. After that, early summer season and the late summer season. So this is how the in the year we have 12 months. So each 2 months we will have one seasonal influence. So we have 6 major seasons. And if you look at that, the during the rainy season, the naturally we have Vadam Pittam Kabam. So that we are aware about that Vadam Pittam Kabam. So here Tannile Virutti and Perennile Virutti are the two terminology actually explained in the Siddha literature. So during the rainy season, to compensate or to tolerate the cool climate, our body actually elevates the pittam. So heat is generated. That is actually physiology. It is normal. So it is actually tannele viruddhi. So pittam is elevated. That is the physiology. In some people, the pittam may not be elevated in an appropriate way. So they will have some problem. Similarly, some people will have abnormal pittam, more pittam, so they will have the problem. So in the healthy person, it will be within the physiological limit. That is what it means. Pittam will be in the physiological limit. Whereas the vadam, that factor will be vigorously grown, which means that is actually goes to the pathological elevation in all the people. So all the people will have some kind of Vadam related symptom during the rainy season. So Vadam related means some kind of dryness, some kind of joint pain or muscular pain. Those kind of the Vadam features will be seen in everybody. So similarly, after the rainy season, the breeze season, actually Kudir Kalam, that is actually having a long night. So less time is less. So the star canopus will be seen during the night. That is actually I also called Agastya star. So that actually give a lot of benefit uh, during the longer night time, and during that time, the pittam actually will will go to the pathological abnormality. So people will have that kind of Pittam related condition or clinical pictures during that period. And the winter, early winter and late winter. So now this is the season, we are in the early winter or late winter season. So here we will have long night. So the earlier the sunset will happen and the people will have more appetite. And here actually Vadam, Pittam, Kabam, all three are balanced in a healthy person. It is supposed to be balanced. So in the early winter season, but based on the individual's Vadam, Pittam, Kabam ability due to the lifestyle and the food and other habits, this may go to abnormal or will be abnormal, may not be balanced. So they will have clinical symptoms of what is actually elevated or depressed. So during the late winter season, the kabam will be actually elevated. So they will have more of like respiratory symptoms, definitely. So we will be focusing on the winter season, early winter or late winter. So based on maybe in your country, in US, this cycle may not be in this way, but definitely every 2 months you may see this influence, or at least even this may not be in this cycle, but it may be in different way. But definitely this influence will be there, and during the winter season, kabam actually will be elevated. That is what the main thing you should understand now. Then there may be different seasons in each country, so this we will not go into deeper. And we should understand that there is a homeostasis in the earth. Okay, so that accordingly, when there is a pittam in the nature, in the earth, so that time more sea water will go up and form the sky. And later, when it gets cooled down, it will give the rain, and the rain will go to the sea. And this cycle is actually continuously happening. Because of this cycle, the earth maintain its homeostasis. Same way our body also has some homeostasis. So what is that? The pittam, the here the because of the heat, water actually evaporates and goes up, right? That is actually comparable with the pittam. And after some time, that will get cooled and will be stored, will be hard, that will be hard and dried. So that is actually compatible with the vadam. And when that actually become the water, and the coolness will be compared with the kabam. So even how the earth undergoes the homeostasis, it is essential seasonal change. Same way, human body also should undergo this cycle. It is actually good for the human health and growth. That is what I say. So is for a simple thing to make you understand vadam, pittam, kabam, the ice cubes, this is actually like a vadam, very hard dried. Okay, and hot water is actually like a pittam, cold water is like a kabam. This is the symbol just for your imagination. When we talk vada, pitta, kabam, you can think this, so that you will understand the nature. For example, vada people will have the characteristic features of ice cubes, like they will, their body, they feel very heaviness. Okay, the joints are frozen, they are very difficult to walk, like that. So these are the very simplest way to make you understand. Even to operate the air condition, we have three modes: cool mode, dry mode, and heat mode. So the cool dry mode is actually vadam, and heat is the pittam, cool is the kabam. So even we need these three mode even for the air condition. So vadam, pitta, kabam is an essential thing in our body. If it is in the balanced state, definitely we will be healthy. So during the winter season, now the kabam is going to be increased, right? So we need to balance the kabam. We need to bring down the kabam. When we talk about kabam, and in the body we have five different bonds, five different organs. They will be having kapha dominated activity throughout the year. Okay, in that the respiratory system is one organ. So when you talk about respiratory system, in our body we have nine orifices or nine openings, like two eyes, two nose, two ears, one mouth, and genital, and anus. These are the nine openings or nine orifices they frequently get in contact with the nature. In that, respiratory system is one of the thing, the external air along with the dust infection and so many things, pollution that will be entered into the body, and the essential things, oxygen is taken and the remaining thing will be not taken by the body. So this is very vulnerable because of the external environment. Even this is also vulnerable part due to the seasonal influence. So, but because of the vulnerability, naturally we have many protective mechanisms. That is also we should understand. So, in the upper respiratory tract, nasal cavity, pharynx, larynx, the throat and voice box. Still here it's upper respiratory tract. Below that, the trachea, the lung, everything are the lower respiratory tract. So we have a lot of protective mechanism actually, even to prevent and to balance the kabam. So for example, we have in the nasal cavity, we have sinus, we have adenoids and lymphoid nasal lymphoid tissues, tubal tonsil, palatine tonsil, and many lymph nodes along with the respiratory tract, many lymph cervical and many lymph nodes are there. Even in the lung also we have lymphoid tissues are there. So we have throughout the lung, we have very good immune system and other protective mechanism and the homeostasis system to prevent the external influence, especially kabam. So in the all the 9 openings, there are actually mucus and skin joining area. For example, nose if you take, or if you take eyes or lips, they are the mucocutaneous junction. Outside the skin is joining with the mucus. Mucus is the inside of the part of the inside inner body, and the skin is the outside. So those areas actually we can see in the 9 orifices, and these are the areas where the pittam and kabam should be in a balanced state. Okay, so the balanced state, they will be more influenced and influenced by the external environment. At the same time, body also has lot of protective mechanism to balance the pitta and kabam in this area. For example, today we are talking about respiratory system. So airways or the respiratory system are lined with the thin layer mucus or fluids. It means the nasal nose or throat or lung, they have continuous secretion of fluids and mucus to protect or to balance the kabam influence. So to even to maintain the breathe air temperature. So suppose excess cold is there outside, but that excess cold air should not go to the lung. So in the cold form. So to make the cold air into a warm air, our sinus actually has a role in that. Similarly, every aspect, our body has the immune system and many physiological homeostasis mechanism. So there are ways to what promote or to facilitate to help these balancing mechanism for our betterment of health. Similarly, when when you are exposed to the cold weather, sometimes in some people we can see excess mucus secretion, and that leads to the sticky mucus or watery mucus. So something, there is a excess secretion. So that will lead to the worsening of the respiratory symptom, maybe cough or rhinorrhea, running nose, everything. So this is actually we should understand this is kabam induced respiratory symptom because excess secretion is there, right? When there is a excess secretion because of cold, it is a kabam induced respiratory symptom. On the other hand, in some people, due to the even in the winter season itself, the or in the summer season, the fluid evaporates faster in the respiratory tract. I told in the first point, there is a fluid secretion continuously in the respiratory system that gets exhausted continuously. Secretion stopped or exhausted. Now, what happened? There will be a dryness in the respiratory tract. This dryness may be because of the vadam, as I told, ice cubes is the vadam, or because of the heat, that is by excess heat, so that evaporation happen, maybe vadam or pittam. That also leads to the respiratory irritation and swelling, and that reflexly will have some compensatory mechanism or uncompensatory mechanism that will again affect your respiratory system. If you are a patient of any asthma or other COPD, then that will aggravate. Now, in this case, in this scenario, that may be because of dryness, because of the Vadam. So, Vadam induced respiratory symptom, or it's a Pittam induced respiratory symptom. So, all the respiratory symptom, what you are seeing in this season is not just because of the Kabam. So, that part we should understand. So, how to understand this? Maybe if you consult with a Siddha physician, they will help actually to find out what influences are, which is actually not balanced in your body, and you are getting symptom by through pulse examination or through other symptomatic inquiry. We can actually find it out. Accordingly, you have to take the treatment. That is what I wanted to emphasize here. Then we have two reflexes, protective reflexes: sneezing and coughing. For the upper respiratory tract, anything foreign body goes, if the body want to reject, then it will do the sneezing. When in the something goes wrong in the lower respiratory tract, in the lung, if it will tell, it cannot cry or it cannot vomit, it can cough. So something is wrong in the lung. So with that sneezing or cough, we should understand something wrong in the upper respiratory or lower respiratory tract. Come to the respiratory symptoms or diseases. So in the modern medicine, we are aware that sinusitis, rhinitis, postnasal drip, nasal polyp, chronic pharyngitis, these are related to upper respiratory airway. In Siddha, actually penism, which means there are 9 type of penism, and that will include the sinusitis, chronic rhinitis, postnasal drip, nasal polyp. These all actually covered in the penism only. And and the chronic pharyngitis is covered in the Kural Kammal. There are 5 subtypes are there. So, uh, uh, so it is actually clearly mentioned seasonal influence and the appropriate treatment. Come to the lower respiratory diseases like dry cough or productive cough, asthma, any infection, TB and other pneumonia, bronchiectasis, even lung cancer, primary or other metastasis, and COPD, hypersensitivity reaction, immunodeficiency. These all actually lower respiratory related condition. They have been actually explained in the Siddha in the Irimal. Irimal mean cough. So 5 different type, and Chayam infections including TB and other pneumonia. 12 types are mentioned. In that TB also included, and the bronchial asthma. In this actually bronchial asthma, one type is actually seasonal influenced bronchial asthma, and many other allergen, food, and exercise induced. So many things, everything is actually covered in the asthma, kasam, and ulai mandai, again tuberculosis and immunodeficiency related lung disease 4, and other lung and combined and extra lung origin, even outside the lung also cardiac problem or tracheal compression due to tumor, psychogenic, they also will produce lung symptom. So they will be all will be mentioned in the Paranoigal 21. So there are a detailed classification of the lung diseases in the Siddha, and the seasonal influence, especially the winter seasonal influence, can aggravate these diseases if you don't have, if you have already. Otherwise, some new symptoms it will appear during this season. So definitely we can actually tackle, we can actually manage with the help of Siddha. That is what I wanted to give here. And the factors aggravating the allergy and flow, if the body is not adapted for the climatic change. So as I told, the body has enough mechanism to adapt during the to undergo to maintain the homeostasis in the body. So if it is there is a problem, the adaptation, definitely we will have the symptom. So we have to work on adaptation, the food therapy and lifestyle, that will be explained by Dr. Selva. And mouth breathing. So if you take mouth breathing, definitely that temperature, air temperature will not be, the body temperature will not be come to the body temperature. The directly the external hot or cold air will be directly passing to the lung. That will affect us. So at any cost, we should try to take the breath through the nose only. I mean, closed mouth breathing. Mouth breathing is not a advised one. Even this also well explained by modern scientists. And the dryness of the nostril. So this I already told you. Dryness may be because of the vadam or because of the pittam. So we have to find out during winter, and person maybe they may use the excess AC or excess heat in the room, in the home. So that will lead to the dryness in the respiratory system, in the nostril especially. So that will actually give some symptoms. So we should identify what is the cause, what is the aggravating factor. Then secretory accumulation due to kabam. So there is a higher secretion, so that leads to symptom. And allergen exposure. So we always think allergen mean it will be from the outside, like pollen or industrial. We will blame the nature or others. But we should also think about our internal inside the home. There are high chance of allergens, like in the even bed sheet or bed and other environment. And fungal, so many things are there. So we should also look at the allergen exposure. Many times we have seen many kids, they get allergy or asthma when they go to bed. So it means the aggravating factor is there only. So this all we have to look into that. And the right lateral sleep or prone sleep. So Siddha emphasis that we should sleep in the left side lateral, so that your pingala, the right nostril will be running, pingala will run, so it will prevent lot of night aggravation diseases, including asthma. So this is also very important. So if you have the sleep habit of right side or prone position, prone mean faces on the bed, that kind of position, so you will be prone for many kind of the diseases actually. And increased airway responses. So when the climate changes, when the cool air or hot air suddenly changes, and the body has the adaptive mechanism, so it will adapt. But in some people, it body will react so much hyper responsiveness. That hyper responsiveness will lead to the allergic rhinorrhea, many symptoms, even asthma also. So that also has to be controlled. That also may be the aggravating factor. And infections, bacteria, viral, fungus, we know many infections are the aggravating factor. And certain foods. So so many foods are actually having allergic nature. So they will be actually called as antigenic nature. So in Siddha they called as a karapan padarthangal, karapan food mean they will be allergenic foods. Apart from that, we should also keep in mind that any protein food can be an allergen. Okay, any protein, be it wheat or cow milk, whatever protein, black gram, dal, anything. So any protein can be an allergen to a particular patient. It's not mandatory to be an allergen, it may be allergen. So we should be first thing, any allergic diseases, if you get, be it a skin or respiratory allergy, first thing in the food you have to think about the protein food and karapan food, that Dr. Selva will talk what are the karapan food. And we have to try to stop and again find the relation between that particular food and allergy, so that you can actually work on that, find out the best food for you. And interruption of the existing respiratory medication. So these are the important aggravating factor of allergy and flu during the this winter season. So next, how to protect Siddha way, that thing actually Dr. Selva will be covering. So I'll be finishing my talk now. Thank you, Dr. Selva. You can continue.
Thank you, doctor. That's a very nice explanation of what allergy is and how it's coming. Now we are going to see Dr. Selva's presentation now. Now he is going to say the Siddha aspect of how we can prevent and all those things. A few of you have requested for explanation in Tamil, so maybe at the end of Selva's presentation, if you have any particular title that you want in Tamil, you can just chat in the window. We will try to explain it in Tamil. Thank you. Selva, we can't hear you.
Okay, now able to hear?
Yeah,
Yes.
now we can able to hear. Yeah.
Okay. Good morning to everyone present in USA, and good evening to India, Australia, Sri Lanka, friends from other parts of the So thank you, Dr. Arul, and thank you, President of GCSMR, Sivasalam, and other friends present in this forum. So we are going to see the preventive methods of respiratory illness in the seasonal allergies and flu. Before going to the topic, I would like to share the statistics and the facts about the allergy. In the US, that is 30% of adults and 40% of children who have allergies. More than 50 million Americans suffer from allergy each year. The rank of allergies, there are many chronic diseases are mentioned by the health departments like Center for Disease Control and WHO. There are many chronic diseases like diabetes, hypertension, ischemic heart disease. So in that line, the allergic conditions among the other leading chronic diseases in US is 6th position. The next fact is annual cost of allergies to the healthcare system in US is approximately $18 billion. The next thing is average amount of time affected persons spend in indoors, 90%. The next interesting factor is percentage of indoor pollutants in US homes versus outdoor pollution is 2 to 5 times higher. As Dr. Arul mentioned in his presentation, that is indoor allergens or indoor pollutants are more than the outdoor pollutants like pollen and other things. So now we go to the what are all the preventive methods. In Siddha preventive methods, there are 3 major subdivisions are mentioned by the ancient Siddhas, that is sage scientists. The first method is lifestyle modifications, exercise, yoga practices, eating habits come under this lifestyle modification methods. The second thing is diet management. This includes home remedies. The third thing is Siddha yogic practices. We are going to cover these 3 simple preventive methods in this session. And if you have any doubts in this particular preventive methods, you can ask me and Dr. Arul. We are ready to answer your questions for better preventive methods in easy way. The first thing is lifestyle. The preventive method is lifestyle. We repeatedly mentioning about the lifestyle modification methods to our patients in our lifestyle workshops and our COVID conditions, pandemic conditions. So the preventive methods are primordial preventive methods mentioned by the ancient Siddhas. The first thing is early morning waking up. So wake up before 5 a.m. is advised by the ancient Siddhas to prevent not only the seasonal allergies, prevent many non-communicable diseases also. So second important thing is manage sleep. At least 7 to 9 hours deep sleep is essential for prevention of seasonal allergies. The third thing is reduce stress level. With the yogic practices and compatible food items, we reduce the anxiety and relax your mind with some relaxation methods. The next thing is drinking adequate water. According to the seasonal modifications. The next thing is niragaram. This is cold rice fermented water. So cooked rice soaked with adequate quantity of water overnight. The next day early morning, we get a very good niragaram, that is cold rice fermented water. 250 ml to 500 ml in the early morning drinking is prevent many allergic conditions. So probiotic and prebiotic present in this Niraharam enhance the activity of gut microbiota. So you all well known about the intestine is the second brain. Many neurotransmitters, many chemicals secreted by the microorganisms can enhance our immune system, like natural killer cells and other immune cells. So it enhances the immune system and further prevent the seasonal allergies. The next important thing is periodical bowel cleansing and periodical herbal oil bath. These two things are very, very important for many disease prevention, especially seasonal allergies. Once or twice a week, take oil bath. We can take oil bath with sesame oil and pepper. You take 100 ml of sesame oil with 1 teaspoon of pepper, boil with a low flame, take oil bath once in 3 days, mentioned by the ancient Siddha books, but you can at least take once a week, take oil bath. This is very, very essential for prevention of seasonal allergy. Then once in 4 months, take bowel cleansing method. The bowel cleansing method, easy, simplest way is a combination of castor oil, ginger juice, and honey. For adult, castor oil 4 teaspoon, ginger juice 4 teaspoon, honey 4 teaspoon. Take once in 4 months. The ideal time for taking this combination is early morning, 4:30 to 6:30 a.m. On the whole day, you take complete rest. You can have, you will get loose stools. You may get vomiting, abdominal discomfortness, and excessive sweating may occur. Don't afraid about this type of symptoms. On that whole day, you take complete rest. From morning to afternoon, you take rice porridge without salt or honey or buttermilk you can take. After 2 o'clock, you can take rice with soup or rice with buttermilk. So these two things are very, very essential in this come under the primordial prevention of Siddha system of medicine, oil bath and periodical bowel cleansing method. Bedi Maruthuvam mentioned in the Siddha literature. This Adarnangu Madikorukal Periyurai Sevam. Once in 4 months, we can take the bowel cleansing preventive method. At least once a week, take oil bath. We can prevent these seasonal allergic diseases. The next thing is avoid chemical products. That is, avoid toothpaste, soap, lotions. These items are flooded with toxins. So toxic toothpaste, toxic soaps, and toxic lotions are gradually suppress the immunity of our immune cells activity. So suppress the immune activity of our defense system. So gradually move to the natural methods of tooth cleaning method and head bath, as well as for other cleaning purposes. These are all the fundamental lifestyle modification methods mentioned in the ancient literature. These have many scientific evidences are also published in the peer-reviewed journals. So first thing is Siddha lifestyle. The second thing is prevention method through the food. So we should avoid the incompatible food items. Many incompatible food are available all over the world. The first incompatible food is modified milk and curd. So we should avoid this type of milk and curd. You all well known about the dangerous effects of white sugar, table salt, and tamarind. You use kokum or Garcinia cambogia, this alternate for tamarind. This is natural tamarind. We used this type of, that is kokum, way back. So try to avoid tamarind, use kokum. The next thing is you should avoid refined oils, wheat, maida, and other refined flours, and modern fast foods. In US, after 1994, that is GMO crops are allowed to sale in the market. So after that period, the allergic manifestations gradually increasing. So in that particular main crop is wheat. So try to avoid this type of genetically modified food items. So these are all incompatible to our system. So our body has 7 fundamental tissues, that is flesh, bone tissues, blood, and other fundamental tissues are present. So these food items are incompatible to those of the fundamental tissues are present in our body. So these incompatible food can cause allergies. So these are all the compatible food: natural grains, greens, vegetables, fruits, natural cold pressed oils, that is sesame oil, cold pressed coconut oil. These are all very friendly to our system. So next, buttermilk, coconut milk, ghee, palm jaggery, honey, sea salt or rock salt, that is Garcinia, kokum, ginger, pepper, and other spices present in our kitchen is also friendly to our fundamental tissues. Also our bioenergetic principle, that is Dr. Arul mentioned in his presentation, Vadam, Pittam, Kabam. These are all the fundamental bioenergetic principles of our body. So Vada is more or less equal to the kinetic energy. Pitta is more or less equal to the thermal energy, and the Kapha is more or less equal to the static energy. So kinetic, thermal, and static energy is regulated by these type of compatible food items. So incompatible food items alter the activity of the fundamental bioenergetic principles of our body. So this slide is very, very important. Bad food combination. So we should aware of the bad food combinations. You also known to the word food interaction. This is a change in the health effects or toxic effect of one food by another food. What are all the bad food combinations? Ghee and honey in equal quantity can cause the toxic effects. Cooked food with uncooked food, that is cooked food, idli with fruits, rice with fruits, it's not compatible. It's a bad food combination. So milk with the fruits, curd with the fruits. For example, mango lassi is very popular in many restaurants. So this is toxic. We should understand. Curd with fruits, any fruit is bad food combination. It can cause the allergic food reactions. So any milk products with the greens. The one example is palak paneer. Is more popular in many restaurants. This is bad food combination. So next combination is milk with the sour, salt, and astringent and a bitter taste. Green leaf with ginger or dry ginger. Chukku, பச்சை இஞ்சி ரெண்டையும் வந்து இஞ்சி அதாவது பெரும்பாலான கீரைகளோட சேர்த்து சாப்பிடக்கூடாது. So greens is not compatible with many greens, many green leaves, not compatible, not best combination with the ginger and the dried ginger. So tender coconut with cooked food items, water or hot water along with diet, fermented rice with sesame oil, black gram with radish, black nightshade with pepper, honey and palm jaggery, millets with milk, radish with milk or banana, beans with fruits, lemon with curd or lemon with milk is incompatible. Milk is incompatible with banana, cherries, melon, and many other fruits, and also yogurt. So this bad food combination is main cause for the seasonal allergies. So we eat in some other seasons, these combinations, it can cause the seasonal allergy, and it's not only in the respiratory allergy, it can produce many skin rashes, or it aggravate the autoimmune reactions. So like rheumatoid arthritis or psoriasis or eczematous reaction or SLE, systemic lupus erythematosus. These conditions are aggravated through these bad food combinations. So we should aware of this bad food combinations. The next thing is prevention method through yoga. The first simple method is abdominal breathing. So abdominal breathing is very, very simple method. You all well known about the abdominal breathing. So many people get into the habit of breathing only with their chest. So inhale through the nose. You should experience the air moving through the nostril into the abdomen. So in that movement, making your stomach expand, then exhale slowly with the abdominal muscle, that is abdominal wall contraction. So in this picture, it clearly mentioned, through the inhalation, through the nostril, you should experience the air moving through the nostril, throat, chest wall, and ultimately into the abdominal. It compress, it lie down the It's audible to everyone?
Now we can hear, doctor. Nadula konjam cut ayiruchu.
Okay. So, okay. This is the abdominal breathing. So, inhale through the nose. You should experience the air moving. You should experience the air moving through the nostril into the abdominal wall. So, exhalation through the.
Can 1 minute, please? Can someone mute your microphone, please? Thank you.
And exhale through slowly by the abdominal, the belly wall contraction, through the belly wall contractions. So inhalation, for example, inhalation 6 seconds, exhalation double the time of the inhalation time. That is 12 seconds approximately. It's not correct measurement. So this is the first method, abdominal breathing. The second thing is Padmasana with chin mudra. This is also very, very essential for enhancing the immune system. At this posture, we can do the Purna Sutti Pranayama. Purna Sutti Pranayama is nothing but forcefully inhale through the both nostrils and exhale through the oral cavity. Inhale through the both nostrils, exhale through the oral cavity with forcefully. This is another method, preventive method for respiratory allergies. The next two things are Nadi Sutti Pranayama. Many of you well known about the Nadi Sutti Pranayama. If you have any doubt, please text me. We are planning to conduct a wellness program. In that program, we are going to teach each and every aspects of the yogic fundamentals as well as the hands-on training. So, Nadi Sutti Pranayama and as well as the B Pranayama also very important to prevent many seasonal allergies. So next preventive method is home remedies. The first simple method is ginger tea. The combination are ginger, dried ginger, pepper, cumin, coriander, clove, cardamom. And this slide is present in our website. I think you can easily take a notes from the website. The next one is the spice powder, the combination of curry leaf, dried ginger, thymol seed, asafoetida, cumin seed, pepper and fennel seed. This spice powder, 1 teaspoon mixed with hot water, morning and evening, is ideal for prevent many seasonal allergies. The next one is the Adimaduram tea, ST Madhu tea. A combination of ST Madhu powder, Kadapai, that is Haritaki, Terminalia, Chebula powder, dried ginger, pepper and poppy seed. The ideal time for taking Adimaduram tea is 7 p.m. to 9 p.m. This not only prevent the seasonal allergy, it also enhance the sleep. It also effective against the anxiety disorders. The next one is the garlic honey. Garlic honey is nothing but garlic juice and honey mixed in equal quantity. Take half teaspoon every day. It prevent many allergic conditions. Some other preventive methods mentioned in this slide. First one is the lifestyle based, that is a steam inhalation. If you get a neem powder, take neem powder 1 teaspoon with water, take a steam inhalation, or turmeric powder, mint, tulasi, pepper, clove oil or nutmeg oil. Any one of the ingredient you can use for steam inhalation for preventive method. The next one is the salt water or alum water gargling as well as the nasal drops can prevent this seasonal allergy. Food-based prevention is also very, very important. You should take black gram, green gram, sesame seed, ghee, coconut, greens. These are all the fundamental food items. Enhance the immune system. It will definitely enhance immune system and prevent the seasonal allergies. The third thing of this slide is safe Siddha preparations. The first one is the Chukkutailam. As Dr. Arul mentioned in his presentation, 9 openings. We use these Chukkutailam as oil bath as well as the nasal drops. So it prevents the seasonal allergies. The next one is Nilavimbu decoction. You all well known about the usage of Nilavimbu decoctions. 1 teaspoon of Nilavimbu Pudini Churanam mixed with 250 ml of water and boil it and reduced it to 60 ml. Drink in the early morning. The ideal time is 6 o'clock or before breakfast. You drink the Nilavimbu decoction every day for prevention of not only prevent the seasonal allergy, it prevent many pandemic flus. The next one is the Tirigadu Churanam, Nellikai Lehiam. These are all available in the Siddha medical shops. It also available in some area of viewers. Need COVID tablet is external usage. 2 to 3 tablets powdered and mixed with hot water, apply in the forehead and over nose. It can prevent the seasonal allergies. These are all the some preventive methods. So these are all some home remedies. If you get some seasonal allergy, nose cold, nasal congestion, or wheezing, you take these home remedies along with your family physician's prescriptions. It may be Siddha or Ayurveda, it may be in the modern medicines. You can take along with that particular medicines. It doesn't produce any toxic or untoward effect. Along with this homemade preparations. The first one is Tirigadu Churanam, that is the dried ginger, pepper, long pepper. All the three ingredients powdered and mixed with mixed equal quantity. For adult dose, half teaspoon mixed with honey twice a day. The next one is steam inhalation with the turmeric powder and pepper powder. The third one is the decoction, tulasi, clove and ginger or dry ginger. Add 200 ml of water, boil it well and reduce to 50 ml and drink along with the honey or palm jaggery. Need COVID tablet, it's an external application we already mentioned. Kaya Tirumeni Thailam or Chukku Thailam for oil bath as well as the nasal drops can prevent the seasonal allergic conditions. The next one is the cold water bath. Tulasi leaf, pepper with the honey, chew in the early morning. Ginger, small onion, garlic, mixed with the honey, chew in the early morning. Dried ginger and palm jaggery combination is very effectively prevent the seasonal allergy. Mint tea mixed with the ginger and honey also useful for the treatment for, that is a home remedy for seasonal allergy. So fundamentally we should focus on the lifestyle, diet, home remedy, simple yogic practices can overcome these seasonal allergies. At this juncture, I should finish. Thank you one and all for this coming to this seminar. And if you have any doubt, please ask me. I and Dr. Arul is ready for answering your questions.
Thank you for the wonderful session, Doctor. As usual, there are many questions coming out. Dr. Shanti, are you available? She will be moderating the question answer session. So if you have any more questions, please put it in the chat window. We will be addressing one by one. Dr. Shanti?
Hi. Hello, good morning, everybody. You can start the questions from the top in the chat box, and people can continue to type their questions in the chat box so that I can go one by one. So coming from the top. I asked Dr. Arul, my question, I think, I asked Dr. Arul Amudan about that sleeping position. He said right lateral position is, as well as prone position, is not good, right? Can you please explain little more on that?
Okay, actually, there is a one cycle like a cardiac cycle, menstrual cycle, like that. One cycle is called Saravotam. That cycle is mentioned. It's actually respiratory cycle. Alternate nostril breathing cycle is mentioned in Siddha. So as per that, today is Sunday, right? Sunday, 6 to Sunday, your time is now 10 to 12. Your left nostril should be dominant. I mean, left nostril should be more flow, airflow should happen. After that, it will change to right. Every 2 hours, it will change. That is the cycle. So during night time, we should, because of the, to prevent from the cold influence, we have to sleep in the left lateral so that the right nostril will be dominating. When you sleep left lateral, the right nostril will flow. When you sleep in the right lateral, left will flow. That is the thing. When we sleep in the supine position, both will run alternatively. So during night time, we are susceptible for some of the diseases like angina or even aggravation of asthma due to that night environment and the climate influence. So if you sleep in the left lateral, we allow the right nostrils to run dominantly. That is actually pingalai, which means which will generate heat in the body. So we can actually prevent a lot of night induced, night related diseases. That is what mentioned in Siddha.
Thank you. The next question is from Rama Jayabalan. Would like to know more about Karappan food. And she wants to answer in Tamil, if possible.
Okay, actually, கரப்பான் அப்படின்னா தோல்ல வரக்கூடிய எக்ஸிமா, அலர்ஜிக் எக்ஸிமா தான் கரப்பான். அது வந்து கரப்பான்னு சொல்லுவோம். ஏன்னா கருப்பா அந்த கருப்பு பிளாக் டிஸ்கலரேஷன் வந்துறதுனால அதுக்கு பேர் கரப்பான். அப்போ வந்து அந்த கரப்பானை வந்து உண்டு பண்ணக்கூடியதான சில உணவுகள் இருக்குது. அதாவது அலர்ஜிக் இன்டியூஸ்டு ஃபுட், அதுதான் கரப்பான் பண்டங்கள் அல்லது கரப்பான் பதார்த்தங்கள் அப்படி சொல்லுவோம். உதாரணமா சோளம், கம்பு, வரகு, அப்புறம் வாழைக்காய், பச்சை வாழைக்காய், அப்புறம் நன்கு முற்றிய பிரிஞ்சால், மெச்சூர்டு பிரிஞ்சால், அப்புறம் சில வகையான மீன்கள், அப்புறம் வந்து கிளஸ்டர் பீன் சொல்லக்கூடிய இது கொத்தவரைக்காய்ன்னு சொல்லுவோம், கிளஸ்டர் பீன். இவையெல்லாம் வந்து கண்டினியூஸா வந்து சாப்பிட்டோம்னா கண்டிப்பாக அந்த பெர்சனுக்கு மோஸ்ட் லைக்லி தே வில் பி கெட்டிங் த அலர்ஜிக். ஸோ அலர்ஜிக்னா தோல் மட்டுமல்ல, தோல்ல வந்து அது கரப்பான், ரெஸ்பிரேட்டரியில வந்து ரெஸ்பிரேட்டரி அலர்ஜி. அதனாலதான் நம்ம வந்து இந்த உணவுகள் வந்து இப்படி அலர்ஜிக் வரும் அப்படின்னு சொல்லி பை தேர் எக்ஸ்பீரியன்ஸ் வந்து ஏன்ஷியன்ட் டேஸ் தே ஹேட் டாக்குமெண்டட். அதுதான் வந்து கரப்பான் பண்டம் சொல்றோம்.
That's great explanation. Thank you, Dr. Arul. And next question is from Satyan. What is modified milk or curd? Even I didn't understand what is modified milk. Dr. Selva or Dr. Arul, one of you can answer, please.
Dr. Selva, are you there still?
Yes, yes. It's a modified means in the ancient days, that is the A2 milk, that is a traditional cow give the traditional milk. So now there is some modification, genetically modifications, some hormone induced excessive secretion of milk. And after coming to the market, demicronization, that is so for preservative added milk is modified milk, I think, in this particular. So it can cause the allergy. So in the ancient days, the traditional milk is available in all over the in our area. Now it is not possible. So preservative added, as well as some traditional modification is there in the marketly available milk. So we can avoid this type of milk and curd.
Just I would add one more. I would like to add one more point. Actually, currently, if you go to the market and buy the milk packet, we can get, even in India itself, we get the 3 different packets. They will ask you want a blue or green or a pink. So it means they have categorized, they are doing some modifications, adding some nutrients or removing some fatty acid. So, and it's not actually what we are getting is not actually the cow's milk as such. And we don't know exactly the source of the packed packet milks, and whether really it's coming from the cow 100% or it's actually mixed with something or synthesized. So in that view only, actually we are not strongly recommending that packet milks are really good. So if you are sure that the source is really from the cow, it's fine. Otherwise, better to not to go with that. And another aspect is the milk and the buttermilk. When it is fermented by the yeast, by the bacteria, then the we will get extra nutrition, and it is actually digestible. And many people will have gut issues. The intestine will have the digestive issues, and the proteins, rich protein present in the milk is not completely digested. Before that, if it is absorbed through leaky gut or some other issue person is having, that will actually produce the allergy. So our suggestion is from the childhood onwards, those kids are exposed with the cow milk, they will actually suffer a lot in future with the allergic disease, because we are exposing with a high protein that is actually not able to be completely digested by that in the small intestine, the immature intestine. So that proteins are absorbed without, before it is actually getting digested. So they will act as allergen, and immunology get triggered in those kids. So as far as possible, if you are not sure it's from the cow, then better to avoid. As a substitute, there are many things. Even the cow milk is actually having the kapha nature. Kapha nature means it will produce kapha disease. This is a well-known fact. Even people who consume milk at night, they will actually have the cough and cold. You can actually observe that they will have nasal blockage and all. It means it is having original cow milk itself having kapha nature. So to reduce the kapha nature, we have to add pepper and karkand sugar candy, or we have to add the uh, ginger. Those things we have to add to reduce the kapha nature. Then only we get actually good benefit. That is the one suggestion. Another suggestion is, instead of the duplicate packet milk, we can go for vegetarian milk. So the cow milk is actually it's produced for its next generation. Same way, when you soak the seeds, any seeds, it will generate extra nutrient for its next generation, for the new growing tree or a plant. So that is actually equivalent to the cow milk. It's for the each key seeds actually having their own specific nutrients. For example, in Tamil Nadu, they consume paruthi pal. Paruthi pal means the soaked paruthi cotton seed, and 12 hours or 20 hours you soak it, and next you grind with the grinder or mixie and take a juice. You will get a nice juice. That is actually vegetarian cotton seed milk. Like soya milk. Soya milk is actually one of the vegetarian milk. You can prepare yourself, and that you can convert into curd, buttermilk, anything you can prepare like soya milk. So this is another option to go to the vegetarian milk. Thank you.
Thank you, Dr. Arul. I learned a lot. From next question is from Kodai. They live in northeast of US, very cold weather there. Neeragaram or oil bath is causing sinusitis for them. So any alternative suggestions they are asking? Dr. Salva, can you please answer?
Okay. Neeragaram and oil bath cannot produce any seasonal allergies. So Dr. Arul mentioned in his presentation 6 seasons mentioned in our ancient literature. At least 4 seasons are clearly defined by defined in US. So each and every season has a specific oil bath we can advise. So in simple method, for hot season, for summer season, use sesame oil with small onion and cumin seed prepared oil for summer season, and pepper and cumin seed mixed with sesame oil. Use it in a summer cold or some winter season. This is first one. The second thing is Neeragaram. If you have any doubt in drinking Neeragaram, you can add pepper powder or cumin seed along with the Neeragaram.
Okay, great. Thank you. And from Talapati, any tamarind substitute? I think you answered already. Kokam puli or kudam puli.
Yes.
Is that right, Dr. Salva?
Yes, yes. Alternate to turmeric, alternate to puli, that is kokum. Kokum is available in all all the Indian grocery stores. You can use. Another thing is mango, amla powder, or you can use the tomato instead of tamarind.
And from Selva Ganapati, you mean we shouldn't drink hot water after food? I think it's from your food related slides he has asked.
So it's not advised to drink hot or cold water during the during any diet. Avoid drinking water during eating.
How many?
Dr. Shanti, I just wanted to, can you hear me?
Yeah.
Oh, this is Shankari's Asylum. I just wanted to explain the rationale Dr. Selva has taught us before. During eating, it's not like you can drink water, but when you eat and drink water, you are diluting your digestive juices, and thereby your digestion is inhibited. So wait up at least a couple of hours, and then you hydrate, or hydrate before, then your digestion is good.
Yeah, 20 minutes before and 20 minutes after I avoid taking water as per Ayurvedic principles and Siddha principle. Will that be okay, Dr. Salva?
At least 30 minutes
30
before food, 30 minutes before food, 1 hour after food.
Oh, okay. Okay. Thank you.
30 minutes before food, 1 hour after food.
Okay.
If that is correct.
I see. And then next question, I don't understand. It's from Dr. Sumaya. Black nightshade. What does she mean? I don't understand. Anybody understand the question?
The slide says the black nightshade cannot be mixed with milk or anything. எனக்கு தெரிஞ்ச வரைக்கும் the black nightshade means it's a kind of green. We call it manathakali kirai. That is black nightshade. That is called the common name for manathakali kirai here is black nightshade. And here in US they think it's poisonous and we cannot eat. But for us it's a medicinal plant and we eat as a vegetable, green, right? Kirai. So that is black nightshade. Please, doctor, correct me if I am wrong.
Yes, you are right, Sandamarai. Manitakali or Melagatakali Kirai.
And then from Kodai, பாலில் விழுந்த பழம் போல் என்று should we avoid even banana with milk? I think in the bad food combination, Dr. Selva, you have mentioned that, right?
Yes.
Milk or curd with fruits, it's bad food, you said.
Yes. So, பாலில் விழுந்த பழம் போல்னு அவங்க சொல்றாங்க in the ancient period. But we also learn from our literature, Paul Bohm, that is prevention of disease through drinking the good milk. So in nowadays, the poisonous milk is not mixed with any other fruits. Can cause the seasonal allergy, not only the seasonal allergy. It can enhance the that is autoimmune reactions in our body. So it can produce many non-communicable diseases as well as the today's topic, seasonal allergy. So we can avoid mixing fruit with the milk.
For all the problems. It's not just for seasonal allergy.
Not only for the seasonal allergy, for all the problems.
Autoimmune
But
disorder.
healthy persons also not use milk with fruit.
Okay.
And curd with the fruits.
Okay. It's commonly in US, all the yogurt is sweet yogurt with some fruits or fruit flavored, or even in Indian, all the restaurants have like fruit salad as a dessert, right?
Yes,
So,
fruit salad and mango lassi is a combination of mango with curd. yogurt. So it, according to our ancient Siddha literature, it is toxic.
Okay, thank you. And then from Satyam, I'm able to grow the Nilavembu plant in my backyard. What can I combine with it to drink? Can you answer, Dr. Salva or Arul? Anyone is fine.
So Nilavembu decoction is a combination of 9 herbs, but very small quantity of Nilavembu, that is 1 leaf, mixed with 1 liter of water, and add half a teaspoon of black pepper powder and boil it. Drink frequently can prevent the seasonal allergy.
Dr. Selva, one question. So they have to start this before the start of seasonal allergy, and if it is so, how many days or weeks before the start of seasonal allergy they have to start this?
A good question. There is a 3 weeks prior to the season. 3 weeks.
Thank you. And Dr. Sumaya, to everyone, purgation is for 6 months once or 4 months once? Dr. Selva?
Purgation is once in 4 months. Adar நான்கு மதிக்கொருகால் பேதி உரை செய்வோம். This is the ancient literature mentioned. It is once in 4 months.
Okay. And I have a question to Dr. Arul. He said, Dr. Selva, you in the bad combination food, you said like honey and ghee are bad combination. But in one of the previous webinars, Dr. Arul said, ஆனைக்கு ஒரு காலம் வந்தா பூனைக்கு ஒரு காலம் வரும். In that he mentioned the bad effects of ghee is nullified by the good effects of honey. So can Dr. Arul explain that with this? So I'm little bit in conflicts now.
Okay. ஆனைக்கு ஒரு காலம் வந்தால் mean from நெய் mean cow ghee. If excess cow ghee consumption in earlier life will definitely will produce the obesity, those complication, and after that to reduce that we have to stop it and start consuming honey. That is the punai. So honey will reduce the obesity. Cow ghee consumption will increase the obesity and fatty. Excess cow ghee will leads to the fat obesity, and that obesity will be reversed by the honey. That is the simple meaning, madam.
But when do we we start the food with lentil rice and then you add ghee and then at the end of the food you can take honey, or you should not?
No. It's not like that. It is mean both are antidotes. Basically, both are antidote to each other, and honey can be therapeutically used as an anti-obese agent. That is the meaning.
Okay.
Dr. Shanti, one thing I learned from all the lectures is that the main thing Dr. Selva has always told us is that taking equal quantities of honey and ghee is very toxic. That thing is so important. So I think that's the message, the pearl message.
Is it at the same time, or okay, morning I take honey after Nilavembu and then in the afternoon I'm taking ghee for my Parupasadam? Is it?
Yes.
Okay.
You're okay with that?
It's okay. So equal quantity, Dr. Shankari clearly mentioned about the equal quantity. There is a 6 teaspoons of ghee per day is advisable. 6 teaspoons of honey is also advisable. Both are elixir, that is both are amirdam, but in a separate time. So you mix 6 teaspoon of ghee and 6 teaspoon of honey in the same time. It can produce some toxic effects.
Okay, and yeah, I understood. Then, so at least there should be some time interval between you take ghee and honey. Okay, I understand. And honey should not be boiled. I learned somewhere. Is that true? It becomes toxic.
Yes.
Okay.
You can add with the lukewarm water with honey, but not boil. You are right.
Okay, thank you. And then the next question is from Talapati. What I understand is it's not healthy to have fruits mixed with milk, which you addressed. And then the next question is Dr. Sumaya. Milk and bitter taste should not be mixed. Means drinking milk and turmeric is not advisable? Dr.
Yes,
Salva?
yes, buttermilk. You add turmeric with buttermilk. It's good, not with milk.
Oh, but
Yes.
okay, one of the I don't know where I learned it from, but you add black pepper powder and then turmeric with the milk in the night, so it reduces the kappa properties of milk. I heard is it's you should not add turmeric powder at all to the
Yes.
milk.
Yes. Yes.
Okay,
You,
thank you.
you should add turmeric powder and pepper powder with either ghee or buttermilk.
Okay, got it. Okay,
Mm.
so in milk you can only add or black pepper powder to the milk to reduce the kabam property of the
Yes.
milk.
Or
Okay.
ghee.
Okay. And then I think the next question is from Shankari, Dr. Shankari. She's my college mate. So she's from California. She's asking age 65 reports that he has phlegm, and she has done a lung and ENT allergy workup and medication, and nothing has been helpful. I feel the diet is causing this. Can you please give some suggestions for less phlegm production? I think it's all in the slides, Dr. Shankari, and I think you can listen to the entire recording in the website also. A little bit later on, I don't know how long after we can listen to the lecture on the website, Dr. Salva.
I think Sandamari may answer these questions exactly.
Okay, Tamrai.
Yeah, maybe we will have in a week or something. But as clearly doctor said, we have all the slides which shows that mainly the milk product is producing the kabam, right? So I hope she was there when he was telling that. But anyway, our recording will be there maybe in a week or something in our website.
And Dr. Shankari, I'll send you some slides on this about when Dr. Selva described about bad food combinations, and then I'll send it to you. Anyway, and then next question is from Shari Devi Dasi to everyone. So paneer is not good to eat. That's, I think, first question. And ginger is generally used when we cook spinach for helping digestion, but we can't use it. So
Yes, the both is answer is no. Paneer is not advisable, and second thing is not using ginger along with the keregal. That is
okay,
greens.
thank you. And next question is from Selva Ganapati Kaliyamurthy. My 4-year-old sneezes in early morning when he wakes up and becomes watery eyes and subsides after steam and then post sleep. He's getting quite often. Please suggest what needs to be taken care of. We have garden next to our balcony and gets dust as well. Can we give him oil bath while he sneezes? Dr. Selva, I think entire lecture of Dr. Selva has to be listened to it again. Selva and Dr. Arul has to be listened to it again. But you can give a brief snapshot, each of you, Dr. Arul and Dr. Selva.
Simple advice is if you have tulasi, that is tulasi leaf, that is a 4-year child, 2 tulasi leaf with 1 pepper and 1 teaspoon of honey early morning, and then
Chew.
with it's a chewable.
Thank you.
Able to hear? It's a
Yeah.
chewable. It's chewable, and add the spices, normal spices, the dry ginger, star anise, cinnamon, and other spice items. Add adequately to the food. Give adequate quantity of ghee, 2 teaspoons in the morning, 2 teaspoons in the afternoon. Is also effectively fight against this sneeze and seasonal allergy.
Oh, thank you. And then from Jay to everyone, I have sinus trouble for 6 years during early winter seasons. winter sessions, not able to recover from sinus. How to heal nose wound? Dr. Selva.
ஜெயக்குமார் ஹியர். நோஸ் ஒன்றுங்கிறது என்னன்னா, அந்த நோஸ் உள்ளார பார்த்தீங்கன்னா அப்படியே ஒரு காயமாக இருக்குங்க, அப்படியே ரெட்டிஷாக இருக்குது நோஸு. அந்த சீசன் வந்துச்சுன்னு பார்த்தீங்க அப்படின்னா அப்படியே சைனஸ் அப்படியே ட்ராப்ஸ் தண்ணியாக அப்படியே வடியும். அந்த ஓண்டு வந்து நான் ஹீல் பண்ணுறதுக்காக நான் முடிஞ்ச அளவுக்கு ஆயுர்வேதிக் எல்லா மருந்தும் ட்ரை பண்ணி பார்த்தேன். ஆனால் அந்த இது வந்து ஹீல் ஆனதே கிடையாது. எந்த மெடிசனும் ஜென்ரிக் மெடிசனும் போனேன். அந்த மெடிசன் அந்த ஆயில்மெண்ட்லாம் அப்ளை பண்ண சொன்னாங்க. அப்ளை பண்ண இது வந்து ஹீலே ஆனது கிடையாது. ஐ வாஸ் ஏபிள் டு ஹீல் அப் டு ஜஸ்ட் 1 or 2 inches in the beginning of the nose. அந்த உள்ள வந்து ஹீலே ஆக முடியாது, ரெட்டிஷாவே இருக்கு.
டாக்டர் அருள், கேன் யூ ஆன்சர் ப்ளீஸ்?
ஐ திங்க் அது உங்களுக்கு வந்து எக்ஸஸ் ட்ரைனஸ் ஆகிறதுனால கூட அந்த மாதிரி இருக்கலாம். அப்படியா இருந்தால் அந்த wound ஹீல் ஆகிறது இல்லை. அப்படி இருந்தால் அதுவா இல்லைன்னா வந்து எக்ஸஸ் இன்ஃப்ளமேஷன்னால ஹீல் ஆகாமல் இருக்குதான்னு ஜஸ்ட் ஒரு தடவை பார்க்கணும். எக்ஸஸ் ட்ரைனஸ்னால ஹீல் ஆகாமல் இருந்ததுன்னா அது வந்து வேற சுக்கு தைலம் அந்த மாதிரி தைலம் இருக்குது. இல்லைன்னா இன்ஃப்ளமேஷன் இருந்தால் அதுக்கு வேற தைலம். நீங்கள் வந்து நேசல் ட்ராப்பாக கண்டிப்பாக நேசல் ட்ராப் மாதிரி அப்ளை பண்ணி 2 நோஸ்ட்லையும் அப்ளை பண்ணிட்டு நைட்டு தூங்கணும். மார்னிங்கும் அதே மாதிரி ப்ரஷ் பண்ணி முடிச்சோன்னா மறுபடியும் இந்த ஆயிலை வந்து அப்ளை பண்ணணும். அப்படி இல்லைன்னா உங்ககிட்ட வேற ஏதாவது இந்த சைனசைட்டிஸுக்கு ஆயில் இருக்கா, இல்லை அணு தைலம், சுக்கு தைலம் இந்த மாதிரி தைலங்கள் இருந்தாலோ, இல்லைன்னா கரிசாலை மடக்கு தைலம் இந்த தைலம் இருந்தாலோ அதை நீங்கள் நேசல் அப்ளிகேஷனா அப்ளை பண்ணினீங்கன்னா அது வந்து இதை ஹீல் பண்ணுங்க. ஆனா ரொம்ப மோர் ஸ்பெசிஃபிக்கா நீங்க சொல்றது என்னன்னு நம்ம கண்டிப்பா பார்த்து அதை ஸ்பெசிஃபிக்கான ஆயில் சூஸ் பண்ணனா ரொம்ப நல்ல பெர்மனன்ட் கியூர் கிடைக்கும்னு நினைக்கிறேன்.
One request to all viewers and everyone. So if we have a personal questions or anything, we have a consultation with Dr. Arul and Dr. Selva. We can do a personal consultation with a minimum donation. That's also available from GCSMR. உங்களுக்கு இந்த மாதிரி பர்சனல் கன்சல்டேஷனும் நாங்க பண்றோம். கண்டிப்பா நீங்க வந்து டாக்டர்ஸ் கிட்ட விரிவா, ஏன்னா ஒவ்வொருத்தருக்கும் தனிப்பட்ட முறையில அவங்க பார்த்து டெஸ்ட் பண்ணி தான் பண்ண முடியும். ஸோ அதனால பர்சனல் கன்சல்டேஷனும் நாங்க அவைலபிளா இருக்கு. நீங்க எங்களுக்கு GCSMR20@gmail.com எங்களுக்கு வந்து நீங்க காண்டாக்ட் பண்ணலாம். எல்லாமே வெப்சைட்ல இருக்கு. ஸோ உங்களுக்கு அந்த பர்சனல் கன்சல்டேஷனுக்கான ஏற்பாடுகள் நாங்க பண்ணி தரோங்க. நன்றி.
Jay, now one more thing I wanted to say exactly the same thing as Tamarai said. Each person is unique, right? So you have you cannot throw the common treatment for everybody, no. So you have to be consulted. I feel that I'm a physician, so I like to know more about you, more about your lifestyle, more about your symptom history and what is the duration. All those things I need to ask before I can recommend specific treatment for your condition. So I think I would strongly advise you to consult one of Dr. Selva or Dr. Arul, and then they can go over your history and prescribe the specific treatment for you. You got it, Jay?
நன்றி. Thank you.
Okay, you're welcome. And next question is Sri Ranjani to everyone. Please explain Vadam, Pidam, Kapam and seasons in Tamil. அருள் சொல்றீங்களா?
சொல்றேங்க. அதாவது நம்ம 2 மாதங்கள் சேர்ந்து ஒரு பொழுது அப்படின்னு சொல்லுவோம், பெரும் பொழுது. அதாவது ஒரு ஜூன் ஜூலை அந்த மாசத்துல வந்து யூஸ்வலா நம்ம தென் தமிழகத்துல இல்ல மேற்கு தொடர்ச்சி மலையில வந்து மழை வருது. அப்போ வந்து அது கார் காலம். அதுக்கு அடுத்த 2 மாசம் கூதிர் காலம். இப்படி வந்து 2 மாசம் வந்து ஒரு காலமா அப்படி சொல்லியிருக்காங்க. ஒரு காலமும் வந்து டியூ டு த என்விரான்மெண்ட், இப்போ வெளியில ஒரு சேஞ்ச், வான மண்டலத்துல இல்ல பூமியில ஒரு சேஞ்ச் நடக்கிறதுனாலதான் நமக்கு மழையோ குளிரோ வெயிலோ வருது. அது ஏன் வருது அப்படிங்கிறது வந்து வேற இது. அப்படி வர்றதுனால இயற்கையிலேயே என்ன ஆகுது, ரொம்ப கோடை காலத்துல வந்து ஏப்ரல் மே மந்த்ல வந்து வெயில் ரொம்ப அதிகமாயிடுது. அப்படின்னா மரம் வந்து இலை விழுது, நமக்கு அதிகமாக வியர்வை வருது. இதெல்லாம் ஏன் நடக்குது அப்படின்னா பித்தம் வந்து அதிகமாயிருது. இந்த வெளி உலகத்துல பித்தம் அதிகமாயிருது அப்படின்னு அர்த்தம். அப்ப அந்த பித்தத்தை நம்ம அந்த உடம்புல வந்து காம்பன்சேட் பண்ணணும், நம்ம உடம்பு குளிர்ச்சியா வச்சுக்கணும். இட் வில் ட்ரை, ஒரு முடிஞ்ச அளவு அதை முயற்சி செய்யும். அப்படி செய்ய முடியாட்டி நமக்கு அதிகமாக தாகம், வியர்வை, இல்லை இந்த எலக்ட்ரோலைட் எல்லாம் இழந்து போறது, வேர்வை எல்லாம் வரும். இப்ப நம்ம என்ன செய்வோம், இளநியை வாங்கி குடிக்கிறோம். ஸோ நம்ம என்ன பண்றோம், அந்த பித்தத்தை ஒரு உணவு மூலம் நம்ம வந்து சரி பண்ண முடியுமான்னு பாக்குறோம். இதுதான் வந்து உணவே மருந்து அப்படிங்கிற கான்செப்ட். இப்போ அந்த ஒரு 2 மாதத்துக்கு ஒரு முறை சீசன் மாறும் பொழுதும் நம்ம உடம்பு இதே மாதிரி அட்ஜஸ்ட் பண்ண முயற்சி பண்ணும். அப்படி அட்ஜஸ்ட் பண்ண முடிஞ்சதுன்னா நல்லது, நம்ம நல்ல ஹெல்த்தியா இருப்போம். முடியாட்டி நமக்கு நோய்கள் வருகுது. அதுதான் வந்து இந்த இந்த இன்னோட டாக்கோட சாராம்சமே. அப்படின்றப்ப நீங்க ஒரு 2 மாசத்துக்கு ஒரு முறையும் நீங்க வந்து உங்க உணவு பழக்கத்துல சில மாற்றங்கள் தேவைப்படும். உங்களுடைய தேய்க்கக்கூடிய எண்ணெய்களாகட்டும், உங்களுக்கு ஏதாவது நோய்கள் இருந்தால் அதற்கேற்ப கண்டிப்பா தகுந்த முன்னெச்சரிக்கை செய்யணும் அப்படிங்கிறதும் நீங்க தெரிஞ்சுக்கணும். இதுதாங்க வந்து இந்த காலம் 6 பெரும்பொழுதுன்னு சொல்லக்கூடிய 6 பொழுதுகள், 6 வகையான சேஞ்சஸ் வந்து வெளி உலகத்துல ஒரு வருஷத்துல நடக்கும் அப்படின்னு நம்ம சொல்லுவோம். அதுல வந்து பாத்தீங்கன்னா நிறைய பேர் சொன்னாங்க, கரெக்டா எல்லா தடவையும் நவம்பர் டிசம்பர் மாதம் மாத்திரம் எனக்கு வந்து ஆஸ்துமா வரும் அப்படின்னு சொல்றாங்க சில நோயாளிகள். அப்ப ஏன் நவம்பர் டிசம்பர் மட்டும் வருதுன்னா, அந்த சீசன்ல வந்து உள்ள வெளி உலக சேஞ்ச் வந்து இவருக்கு வந்து பாதிச்சிருக்கு. இது வந்து எல்லா வருஷமும் அவருக்கு கண்டினியூ ஆகுது. ஏப்ரல் மேல மட்டும் எங்களுக்கு வந்து அம்மை நோய் வருது, இல்ல ஒரு பர்டிகுலர் நோய் வருது அப்படின்னா அந்த வருஷத்துல அந்த 2 மாசம் உள்ள பொழுது வந்து இவருடைய உடம்பை பாதிக்கிறது. இதுதான் வந்து இந்த சீசன் அப்படின்னு நம்ம சொல்றோம். அது போக வாத பித்த கபம் அப்படிங்கிறது வந்து இந்த ஒரு சீசன்லயும் ஒண்ணு மேல நிற்கும், ஒண்ணு கீழே போகும், ஒண்ணு சமநிலையில நிற்கும். அதை வந்து நம்ம உடம்பு வந்து பேலன்ஸ் பண்ண முடிஞ்சதுன்னா நம்ம நார்மல் பர்சன், முடியாட்டி நம்ம வந்து நோயாளி. இதை வந்து நம்ம பேலன்ஸ் பண்றதுக்கு தான் இந்த சித்த மருத்துவம், உணவுகள், மருந்துகள் எல்லாம் இருக்குதுங்க. போதும் நினைக்கிறேன்.
Yeah, that's great. From Devamani Sivasailam, is pasteurization considered modified milk? Dr. Salva?
Yes, pasteurization is also a modified milk.
In US, you mean to say that we can't really get unmodified milk?
Yes. So we in our clinic, the prescription, we write first avoidable food items. The first item is the milk.
Yeah. Okay. Next question.
யூஎஸ்ல நான் பாஸ்டரைஸ்ட் மில்க் கிடைக்குதுங்க. மீன் லோக்கலா கிடைக்குதுங்களா? நாங்க வெர்ஜினியால இருக்கோம்.
எப்படி
அங்க ஃபார்ம்ல, லோக்கல் ஃபார்ம்ஸ்ல போனீங்கன்னா நீங்க நான் பாஸ்டரைஸ்ட் மில்க் வாங்கிட்டு வரலாம்.
அவங்க ப்ரிசர்வேட்டிவ்ஸ் ஆட் பண்ணிருப்பாங்களா? பிகாஸ் அவங்க நாங்களும் we are buying raw milk, ஆனா ப்ரிசர்வேட்டிவ் ஆட் பண்றாங்களா என்னலாம் எனக்கு தெரியாது.
ஓகே.
நான் ஜெய் ஃப்ரம் மின்னசோட்டா. இதே மாதிரி அவர் சொன்ன மாதிரி இங்கே நான் பாஸ்டரைஸ் நானும் கிடைக்கிது. நான் வாங்குற அந்த மில்க் வந்து ஃபார்ம்லேயே வாங்கிட்டு வரோம். அந்த ஃபார்ம் வந்து மேக்ஸிமம் டியூரபிலிட்டி வந்து எனக்கு 5 days தான். 7 days. அதுக்கு மேலே அந்த பால் யூஸ் பண்ண முடியாது, கெட்டு போயிடும். ஸோ நோ பாஸ்டரைஸ், நோ பிரிவென்டிவ்.
நாங்க ஃபுல்லா இப்போ ஹோல் ஃபுட் பிளான்ட் பேஸ்டுக்கு மாறிட்டோம். நோ அனிமல் ப்ராடக்ட்ஸ், பாலும் எடுக்கிறது கிடையாது.
நைஸ்.
ஜெயபாலன்,
of alternative medicine advice against milk after 2 years of age, I think.
Yes.
ஜெயபாலன், இது நார்த் தமிழ்நாடு இது மாதிரி எல்லா ஸ்டேட்லயும் இது மாதிரி கிடைக்குதுங்க. நான் பாஸ்டரைஸ்ட் மில்க் கிடைக்குதுங்க லோக்கல் ஃபார்ம்ஸ்.
Okay, thank you. Next question is how to avoid allergies like red eyes, sneezing during springtime because of plants and trees. I think you should listen to the entire lecture in the website sometime soon, because I think they have answered repeatedly on this actually. So I'm going to proceed to the next question from Devamani Sivasailam. Allopathy medicines such as Claritin for dry, which causes dryness. I don't understand the question anyway. So is there
sorry, let me I mean, for allergies we take Claritin here sometimes to what I meant by dryness is it kind of reduces your running nose and then activities like that. Is I know need kopai marundu sonnaru Dr. Selva. Is there other medicines, internal medicines we can take in Siddha for but I think it's an individual, like you said, it's an individual, I think one-on-one consultation. I'm sorry.
So many anti-allergy drugs available in a natural way. without causing the side effects of the dryness of the mouth or dryness of the nose.
Okay, and then another question from, thank you, Dr. Selva. Shari Devi, the C to everyone. Fruit milkshake given to kids are not good. I think you answered already, it is not good. And Uma Srivatsa, she's a cardiologist, my classmate, she's in India right now. Does soy milk cause hormonal imbalance, especially for men? Dr. Selva, can you please answer?
Yes, we should avoid soy milk. So instead of using soy milk, we can use coconut milk or almond milk or peanut milk. If it is not allergic to the peanut, you can use peanut milk. As well as green gram milk. These are all the safe. Green gram means பாசிப்பயிறுன்னு தமிழ்ல சொல்லுவோம். இதெல்லாம் each 6 hours தண்ணியில் ஊற வச்சு அரைச்சு எடுத்துக்கலாம். But soy milk can cause some physiological changes in our body. It's right.
Dr. Selva, one of my art of living friends said, like, no, they avoid excessive, soya products because it increases the estrogen in the body, and it can potentially, if you take, especially vegetarians, they rely on soy milk protein, so it can cause breast cancer. So is that
yes, it can cause some incompatible to our system. I also understand in some conditions it can.
Yes,
Kathy, can I answer? Okay.
Yes.
Because and Shankri Sivasairam, I'm a medical oncologist, so I can take this question that you raised about the soy milk. So actually, there is data now. We used to think like, universally soy milk is going to induce breast cancer cells, but then there is a recent trial, a publication that they said that soy milk, usually the estrogen is phytoestrogen. So what they are saying is that it actually mimics and it can block the receptors so that your circulating estrogens, do not stimulate and cause proliferative effect. So what I tell my patients is that, if you eat a little bit of soy based in your diet, it's okay not to be fearful, but you don't want to take a lot of anything, right? That's the most key. So I don't think like if you eat a little soy, it's going to induce breast cancer. The data doesn't show that now because it's phytoestrogens. It's a little different type of estrogen. At the same time, you don't want to overdo anything. So there is a moderation. Like, if you're taking a little tofu, I have no problem. It's not like the data is not clear cut that it will totally induce breast cancer.
Okay, thank you.
Yeah, I would like to add one more thing. This is RK from Virginia. I was about to suggest what Dr. Shankari was alluding to. Soy products, especially non-GMO soy products, are considered good for both men and women, even for cancer patients. You can check nutritionfacts.org by Dr. Michael Greger. So he has given a lot of, he cites a lot of studies published in the PubMed that say soy products are good for cancer patients.
Thank you, Doctor. Thank you, RK.
Yeah, thank you.
Next question is, can you suggest some alternate ways to take them? It is from Shari Devi Dasi. I didn't understand your question, Shari. Can you please explain on your question? I don't understand your question. We'll pass on to the next question. From Manikandan, is the cow ghee made from A1 cow milk really safe? Dr. Arul or Selva, anyone can answer, please.
A2 milk is safe. A2 milk is a traditional milk.
Okay, here he asks A1 cow milk.
I don't use A1 milk and the effects of A1 milk in clinical conditions. So A2 milk is safe, and A2 milk means A2 milk products like buttermilk as well as the ghee is safe. By I didn't experience in that A1 ghee usage.
Okay, thank you, Dr. Salva. And next question is from Satyan. Is that it is said that dhania is helpful in preventing heart ailments and diabetes? Similarly, is dhania good for allergy preparation? Dr. Salva, because you talk more on the food aspect, right? Can you please
Okay.
answer?
Dhania is very good for allergic conditions as well as some high blood pressure. We can use along with any medicines. We can use freely, safely use dhania with the cardiac medicines or high BP medicines or any allergic medicines.
Thank you.
It is safe as well as some efficacy is documented in some clinical research.
Okay, thank you. Dhania is the coriander seeds you are talking about.
Yes.
Okay, thanks. And from next question is from Anand. Can we add lemon juice in coconut water and drink before food? I heard it'll increase vitamin C consumption by 10 times. Is that true?
Lemon juice with
Coconut water.
coconut water.
And drink it before food.
You drink separately coconut water and drink separately the lemon juice. Don't mix.
Yeah. One thing from allopathy I can give some input is, see, lemon juice has vitamin C, and it is, if you take any acid preparation with milk or anything which is alkaline, it reduces that absorption. So I don't know the pH of coconut water, but lemon juice is it causes acidity in the stomach. So, okay, we'll not combine as per Dr. Salva. Thank you. Satyan to everyone. Doctor mentioned not to drink water 1 hour after eating. Some of us have gastric problems. What should be done? Dr. Salva?
So if you have any gastric issues, you should avoid drinking water during eating. So advice is early morning waking up and drink adequate quantity of cold rice fermented water. That is neeraharam can prevent the gastritis. You can drink normal lukewarm water prior to 30 minutes prior to the food is advised.
Okay, thank you. And the next question is Subhadra to, what is the best treatment for ankle swelling? I think Subhadra, you need consultation, because I'm from allopathic perspective, I'm telling you, ankle swelling can happen because of either heart failure, kidney failure, or liver failure, or simply because you have varicose veins or your lymphatics are not pumping up the lymph from the lower legs, or your veins are not pumping the blood from the legs. So that's why you get ankle swelling. But you need a consultation, medical consultation to evaluate this. You can consult Dr. Selva or Dr. Arul. Anyway, Dr. Selva or Arul, you want to answer this from your perspective?
Dr. Arul?
As madam told, actually, we need to find out the cause, whether it's locally any related to local tissue inflammation or systemic. So most probably 90% it must be from the systemic only, cardiac or any other disease. It's one of the earlier signs. So you can actually evaluate it and identify. So specific treatments can be taken. So better to consult an allopathy doctor for this to get the exact diagnosis. That is what my suggestion.
Yeah, thank
Even
you for
if
pointing out the local cause, Dr. Arul.
Yeah.
I forgot to mention, yeah, it could be local cause also. So whether it is one side or both sides, and then any pain with movement, all that has to be evaluated before we Always address the problem, address the cause of the problem, address the complications of the problem. So we have to evaluate you thoroughly. So I think you should go for consultation either with allopathic doctor or with Siddha doctor. I mean, it's too generous. It's a generic question to answer. You need to be consulted. Then next question is from Kodai. Can we take tofu with spinach as an alternative for palak paneer? I think she really likes palak paneer. Dr.
Yes,
Selva, can you answer?
So I
She's
really,
bargaining with you.
I am not convincing with the tofu. So we should avoid tofu also.
Okay, thank you. I think it's a difficult question, I feel.
Yeah.
From Talapati, the combination of cleansing is common for all ages and weight. Is it okay with the patient who had angioplasty done? Dr. Salva?
A patient with,
Angioplasty?
yes, yes, you
I
can.
assume it is
Yes.
coronary angioplasty, not peripheral vascular.
Okay, okay. Coronary angioplasty, you consult your physician before taking the cleansing method. That is what the cleansing method is suitable for him. Based on the advice from your physician, you can take the cleansing method.
Okay, thank you. And from Talapati again, 4 spoon of ginger, 4 spoon of castor oil, and 4 spoon of honey. Yeah, that is that is for the adults. Dr. Selva suggested 4 teaspoons of ginger juice, 4 teaspoons of castor oil, and 4 teaspoons of honey. Am I right, Dr. Selva?
Yes, this is the correct combination for the adults.
Thank you. And from Selva Ganapati, okay, I think he just thanked everybody. Okay, and from Chitra, is it okay to have sesame oil bath for summer? Then which oil is for winter? I think Dr. Selva answered this already, and we are really running short of time now.
You know what, Shanti, the one thing is Dr. Selva said that what you add to the sesame oil is
Yes.
different between summer and winter. Pepper
Yeah.
is always sudu
Correct.
undu pannom, so use it during the winter months.
Sesame oil with
pepper.
onion and something.
Onion vandu cooling. Onion vandu summer la.
Summer, yeah.
Correct.
Dr. Selva, can you please answer this again so that I also register?
Sesame with the cumin is common for both seasons. Sesame and cumin,
Okay.
cumin seed. For summer season, add small onion shallots. For winter season, pepper.
Thank you. Okay, that's great. From Grace, inhalers are taken here when breathing gets difficult. So I don't know, is there a question there or not? But anyway, next question is Hema. Is it good to take tofu? I think you answered already, right, Dr. Sal? In moderation is fine, as per Dr. Shankari and Dr. Selva. From Grace.
Shanti, sorry to interrupt. What Pushparani Williams Grace was asking was, is there anything in Siddha? I think the inhalation, steam inhalation is probably equivalent to inhalers, but Selva or Arul can probably correct me or...
Dr. Arul can explain clear than me.
So actually, for the quick relief, definitely allopathy inhalation, the nebulizer or metered dose inhaler is actually definitely good. They will directly, very specifically act on the particular beta 2 receptor and dilate the bronchus. So quick relief will be obtained. But what we can do from Siddha side, after detailed evaluation, we can give few drugs that will actually slowly will start its action because many the underlying pathology is there behind the symptom and signs. Many things are actually happening in your lung, so that has to be addressed. So in the quick relief metadose inhaler or puff, that is not addressed. So the underlying problem will be actually taken care gradually with the Siddha medicines, and that will actually reduce the frequency of your usage of meter dose inhaler or puff. After some time, actually, it will give a lot of relief. Even many patients can live without the puff. So this is our experience, but still treatment requires 2 to 3 months minimum with the Siddha drug for that to stop the inhaler. So instantly that relief is actually not obtained from Siddha medicine.
Thank you, Dr. Arul. And then the last question I think we have in the chat box is from Compact. Can we use vetiver to soak overnight and drink the filtered water in the morning? Is it better than using RO water? Dr. Selva Arul can answer this, please.
Yes, it is very good herbal water. It is very traditional one also.
Dr. Selva, I want to make sure one clarification. If RO water is part of filtration process, so my question, I mean, vetiver is good, but I wouldn't look at it as using it one or the other, right? Because the filtration process happens by RO techniques in India.
Shankari, can I answer this? Long-term RO water intake has its own implications in causing electrolyte disturbance in your body. So I don't know more about it, but still RO water has its own implications. I would go with anything natural is better. But Dr. Selva, any thoughts on that?
So natural filtration methods are mentioned in the literature. That is sand filtration as well as the herbal powder filtration methods are mentioned. That is one thing is tetran kotai mixed with water. Tetran kotai. That is one herbal nut mixed with water. That is ஒரு பெரிய பானை அளவுக்கு நமக்கு வந்து ஒரே ஒரு கொட்டை உரைச்சு அதுல நம்ம வந்து கலந்து வச்சிட்டோம்னா it has the good effect. ஸோ அந்த RO வாட்டர் நீங்க சொல்ற மாதிரி இது லாங் டேர்ம்ல யூசேஜ்ல வந்து நமக்கு கொஞ்சம் சில டிஸ்டர்பன்ஸ் கொடுக்கறதுக்கு நிறைய வாய்ப்புகள் இருக்குது. ஸோ நேச்சுரல் மெத்தட் தான் இதுக்கு பெஸ்ட்.
டாக்டர், சாரி டு இன்டரப்ட், நான் கமல்ராஜ் பேசுறேங்க. இந்த தேற்றான் கொட்டைங்கிறது வந்து do we need to do that, soak it in the water for overnight or any specific timeline or
minimum 6 hours is enough, Kamal.
நன்றி
டாக்டர். இது எனக்கு ஒரு கேள்வி இருக்கு, நான் சத்யன் பேசுறேன். இப்போ அது டாக்டர் சாந்தி சொன்னாங்க இந்த மாதிரி RO வாட்டர் வந்து லாங் டேர்ம் பெனிஃபிஷியல் இல்லைன்னு. நாங்கள் வந்து யூஎஸ்ல இருந்து ஜீரோ வாட்டர்னு ஒரு ஆப்ஷன் இருக்கு, அது ஆக்சுவலா எல்லா இதுவும் ரிமூவ் பண்ணிடுவோன்னு. ஆனால் நான் வந்து ஓவர் நைட் காப்பர் வெசல்ல தண்ணியை வைக்கிறேன். ஸோ அது ஒரு ஃபர்ஸ்ட் கேள்வி வந்து அது பெனிஃபிஷியலா, டெய்லி காப்பர் வாட்டர் குடிக்கிறது நல்லதா? அதே மாதிரி அதுல வந்து வெற்றி வேறும் நைட் ஊற வச்சா அது ஒன்றும் நல்லதா?
இல்லை, காப்பர் பாட்டிலில் நீங்கள் வச்சிங்கன்னா தனியாக காப்பர் பாட்டில் மாத்திரம் யூஸ் பண்ணுங்க. அப்புறம் நீங்கள் வந்து மறுநாள் காலையில் அந்த காப்பர் பாட்டிலில் உள்ள வாட்டர் யூஸ் பண்ணிவிட்டு மறுபடியும் நீங்கள் வாட்டர் ஊற்றுறதுக்கு முன்னாடி கிளியராக அதை வந்து நம்ம நேச்சுரலாக மெத்தடில் அதை வந்து க்ளீன் பண்ணியிருக்கதான்னு என்ஷூர் பண்ணிட்டு தான் அடுத்த நாள் தண்ணீர் ஊற்றணும். அதனால் அந்த காப்பர் பாட்டில் யூஸ் பண்ணுறதுல ரொம்ப பெரிய விஷயம் என்னென்னா, அதே இது காப்பர் பாட்டிலில் மறுபடியும் தண்ணி ஊற்றுவாங்க. அது வந்து கொஞ்சம் டாக்ஸிக் எஃபெக்ட் லாங் டேர்மில் வரும். அதனால் ஒவ்வொரு நாளும் நீங்கள் தண்ணீர் ஃபில் பண்ணும்போதும் அந்த காப்பர் வெசலை வந்து ப்ராப்பராக க்ளீன் பண்ணணும். ஒன்று, அந்த காப்பர் பாட்டிலில் நீங்கள் போடும்போது அந்த வெட்டிவேர் இந்த மாதிரி விஷயங்கள்லாம் போடாமல் தனியாக போடுறது நல்லது. எனக்கு தெரிஞ்சு நீங்கள் வந்து காப்பர் பாட்டிலில் துளசி இலை போட்டு குடிச்சிங்கன்னா பெட்டர் எஃபெக்ட் கிடைக்கும். நீங்கள் போடும்போது நீங்கள் வந்து மண்பானையில் போடும்போது வெட்டிவேர் போட்டுக்கலாம்.
ஓகே. இப்போ காப்பர் வாட்டர் கிளீனிங் எப்படின்னு எங்கே பார்க்கறது?
ஒன்றும் இல்லை, நம்ம வந்து இந்த நேச்சுரல் டேமரின் சொல்கிறோம் இல்லையா, கோக்கம் சொல்கிறோம், அதை வச்சு நல்லா அந்த கோக்கம் வாட்டரை வச்சு நல்லா உள்ள வாஷ் பண்ணிட்டாலே போதுமானது.
சும்மா கை வச்சு அப்போ வந்து கோக்கம் வந்து ஒரு 4 மணி நேரம் ஊற வச்சு அந்த தண்ணி போதுமா? எவ்வளோ நேரம் ஊற வைக்கணும்?
இல்லை, நீ ஜஸ்ட் ஃபியூ மினிட்ஸ், தட்ஸ் ஒரு 3 to 5 minutes கோக்கம் வாட்டரை வச்சு நல்லா தேய்ச்சி விட்டுட்டு அப்புறம் வாஷ் பண்ணிட்டீங்கன்னா போதும். ஏன்னா டெய்லி நீங்கள் பண்ண போகிறதுனால இதை நீங்கள் ஒரு 3 to 5 minutes வச்சாலே போதும்.
அது அந்த கோக்கம் வாட்டர் எப்படி தயாரிக்கிறதுன்னு புரியல.
Regular tamarind can be used, no, Dr. Selva, for that?
Yes, tamarind can be used.
அது கொஞ்சம் தண்ணியில கொதிக்க வச்சு அந்த தண்ணியை வந்து வாஷ் பண்ணிடணும்.
கொதிக்கலாம் வேண்டியது இல்லை, சும்மா ஜஸ்ட் கொஞ்ச நேரம் ஊற வச்சீங்கனாலே.
நீங்க ரொம்ப யோசிக்க வேண்டாம், புளி போட்டு பாத்திரம் நீங்க வீட்ல
புளி
அம்மா
போட்டு தேய்க்கிறது சொல்றாங்களா? ஓகே ஓகே
அதேதான் புளி போட்டு தேய்க்கிறது தான் இது சொல்றாங்க.
ஓகே ஓகே இப்போ புரியுதுங்க.
Okay, Dr. Selva.
Yes.
I think we
want
are
to
running
add
out
one
of
last-
time. We can we have to wrap up in few minutes. Thank
I
you.
think with the last 2 cents I'll throw. So for you to add any vetrivair or all those things, I think the water first of all has to be safe. So the the water, if it has more bacteria or virus, the best way to sterilize the water is boil it for 3 minutes, then you cool it down and drink it, and then you can add whatever you need to add. But first of all, the water has to be safe. And I don't know whether this adding vetiver or keeping it in the copper vessel will sterilize the water of the bacteria and viruses. I do not know about it. What is your thoughts on
Some analysis taken by in some area, Tirunelveli, Alvarkurichi, copper vessel or silver vessel can reduce the bacterial contamination for overnight soaking in the I think copper vessel as well as the silver vessel also.
Okay, thank you. But it will not eliminate 100%, right? But
Yes.
for boiling the water for 3 minutes above the boiling point will eliminate viruses and bacteria. And also this in India there is another water system we use, no? This AquaGuard. AquaGuard doesn't filter certain bacteria as well as viruses. You can still get hepatitis E as well as leptospirosis through AquaGuard water. So generally, I advise my patients to drink boiled and cool water if you live in an area where the water is not safe. Yeah, that's all my 2 cents at the end.
So if we don't have questions, I think we can wrap up. And still, if you want to contact us, we can please send us email at gcsmr20@gmail.com. All information are available in GCSMR, our website. And even in our website, we have all this food preparation that is the chukumali coffee and all those things. It's there in our website under food as medicine. Please check our website regularly for our monthly free webinar. Every month we do it in a different health topics. Coming October also we have one, and November. We have many other topics also coming near in future months. Please stay tuned with us. We also have a Telegram group and WhatsApp group. If you'd like to get joined in those groups and get regular messages from us, please email to us. And again, thank you all for joining. So due to the time constraint, we have to stop here. And many of you have joined from different part of the countries. It will be so late for you. Once again, thanks for joining. Stay tuned with us. We have more health topics coming in next month. Thanks for joining, and thank you, Dr. Arul, Dr. Selva, as usual, for your wonderful presentation, and Dr. Shanti for moderating this time, and also Dr. Shankari. We have a very good group of advisory committee doctors, both in Siddha and allopathy in GCSMR. Looking forward to meeting you all again. Thank you all.
Thank you. Thank you.
Thank you.
Thank you, Tomarai.
Thank you so much.
Thank you, everybody.
Good luck to everyone. Bye-bye.
Thank you so much for all.